So when you begin marketing and scaling your sleep practice through social media advertising, whether you're doing billboards, radio, any type of lead generation, inevitably what you're going to encounter people who call and their very first question out of their mouth is, how much does it cost? So I want to talk about exactly how you can address that question respectfully, but at the same time, help the patient realize that price is not the main concern and insurance coverage is not the main concern. What is the main concern? What you're going to help them see is that the main concern is their health, how long they're going to be around for their family. So I want to talk about how you can deal with the objection or the comment when it's the first thing out of the patient's mouth or your lead's mouth. How much does it cost? You have to train your staff on how to be able to handle this respectfully. The first thing that you need to do in order to avoid this being even a topic of discussion until the point of treatment really is separate the finances from the person having the conversation with the leads that you're generating for your sleep practice. What I mean by that is you need to have a person who's designated to follow up with those people whose primary concern is learning whether or not you can help them or not. That person is completely separate from the person who handles the financial discussion. The reason you want to structure your office this way is because then the person who's talking to the lead can focus on what matters. And that means, can we help you? Are you currently wearing CPAP? What don't you like about your CPAP? Why are you calling us today? Those are really important. Understanding what the patient's frustrations are with their sleep patterns or whatever the case, their snoring or bed partner, whatever the case, that person's responsible for learning everything they can. And the patient or the lead that you've generated when having the conversation with them now feels like they've just received an incredible amount of value because there's no discussion of price or insurance coverage. It's just, how can we help you? Let's figure out if we can help you or not. And when your staff can say, actually, I'm not responsible for the financial conversation. I don't even know what you can expect in the way of coverage for your insurance. Marissa at the office handles those conversations. And, once we're done with our conversation and we determine whether we can help you or not, we can transfer you over to Melissa and we can get all of that figured out. And the patient's like, oh, okay, you don't handle the money conversation. Someone else in the office says, that's great. Let's focus. Okay, what do you have to say? That is going to completely remove the objection up front. Now, inevitably, people will ask the question, how do you handle the question? To handle the question, you want to first ask another question, and you want them to actually answer no to this question. The question you want to ask them is, are you opposed to having any out-of-pocket costs? After everything we've discussed, here's how this can help you. Are you opposed to having any out-of-pocket costs? And you want the person to say no, because it's much easier for the person psychologically to say no than it is for them to say yes. So you want them to say no to that specific question, because what that question does in their mind, it triggers a response that actually opens them up to the possibility of having to come out of pocket some or maybe their entire deductible in order to cover the cost of treatment. So that's the first thing. Second thing is you want to ask them, if you really want me to pursue this, do you want me to pursue an explanation of benefits with your insurance? That way we can find out what's covered, what you're going to be out of pocket. And then you can get into, here's our cash price, and then here's what your insurance covers. All of that can be determined after those questions are answered. So the first question is, are you opposed to having to pay some out-of-pocket costs to achieve this goal that we talked about of helping you sleep better? Get back in the same room with your spouse or bed partner. And second, do you want me to pursue an explanation of benefits so we can determine what you're going to be out of pocket and what your insurance will cover? Those should handle most of the financial objections. Now, if they are not willing to pay their deductible, there's lots of reasons people don't want to move forward with treatment, but help the patient understand they're going to have to pay their deductible, whether it's at the beginning of the year or the end of the year, and then you revisit their goals. Why they want to sleep better, why they want to stop snoring, why they want to get rid of the CPAP machine, and say, you could sleep better now, or you could sleep better at the end of the year. So it's about framing the conversation with the patient and letting them know that price should not be your primary concern. Your primary concern needs to be your health.